Hi, welcome to week 4 of GEM, where we're going to talk about telemedicine and screening for depression and alcohol use disorder. So we'll be looking at several items today, primarily how to conduct an effective and private telemedicine visit and how to implement the 4 habits within this visit. We'll briefly look at physical exam maneuvers that you can do, the observable physical maneuvers, but primarily we'll be preparing for our SIM next week where we will be able to implement the depression and alcohol use disorders screening through the telephone or video visit. So let's get started. Pretty much most of what we'll go over today is going to be summarized in this one-page pre-work flyer that is on Alintra for you, including how to get set up for your successful visit. Okay, let's look at how we're going to set up our technology today. The most important thing is to make sure that the webcam is eye level or near eye level. Looking down or looking up really distorts the image and can be very disconcerting for the viewer on the other side. You also might want to think about using your phone as the camera and then your laptop for looking at the charts so that you're not bouncing back and forth on the same screen, although some people do prefer to do side by side. So whatever works best for you, but practice with that. And then if you are using your phone, do put it sideways into landscape. You'll find that you'll have much more real estate to look through. And you also are probably going to have to convince your patients on the other end to do the same. You'll see a lot more most of the time. Make sure your mic and speakers are working, and to reduce the pings of distractions, please make sure all the other apps are set to do not disturb. So during the SIM event, we're going to use Zoom or Teams, but in the clinic in LIC, you'll use Kaiser's Healthcare Anywhere, HCA. You'll be able to either make a phone call through that so you don't have to give out your phone number, or start the video directly through there. A video had been produced previously for your viewing during EIE to show you how to do that, so feel free to refer back to that before you use this in the LIC. One of the weird tech things is the KP system is very glitchy about changes in signal, trying to make sure we protect everyone's information. So if a patient changes the camera, like from front to back, or an incoming text or calls to them, sometimes it will drop them out of the HCA visit. So it is important to let the member know ahead of time if they get disconnected, just to click the link and come back. Not only must we maintain our patient's privacy for legal reasons, but ethically and for better patient trust, you really must make sure that you assure the patient that you are maintaining their privacy. Best way to do that is to let them know or see that they are in a secure environment on your side, that the doors are closed, no one else is behind you, able to listen or to see, and also check in with them and make sure they're in a private and secure location. Look around you. What's your workspace look like? Is it professional or is it messy? Or is there too many personal items behind you that will be distracting to your patient? So do make sure that your area is tidy. Do not eat or drink. Very unprofessional. I put virtual background as a plus minus. If your background is so chaotic, you may want to consider a virtual background if it's available, although it's not currently on HCA. But also recognize that may add another level of question or distrust. The patient doesn't know what's actually happening behind you. So consider that. But do also notice what you're wearing. You should always wear your professional attire, which you would wear face-to-face visits, and have your ID badge available and visible to the member. And the distracting clothing. If you have lots of bright colors or stripes, patterns, sometimes it doesn't pick up on the camera very well. Most important, look at the lighting. Make sure you're not backlit like in a witness protection program. Also, if that camera's too low, even though your lighting may be great, you might be off screen or they're looking up your nose, or maybe the lighting is off completely. You forgot to turn on your camera. So notice on the lower image, the camera's at eye level. The student is looking directly into the camera, creating a very good feeling of having eye-to-eye contact. The lighting is appropriate. You see her white coat is on. Um, this is a much better presentation. So I briefly mentioned this. Look directly at the webcam. The patient will see it as if you're looking directly at them. So if you're looking down or away, it feels very impersonal. It's quite difficult to do, and it takes practice because you may see them moving at a different part of your screen, and you can't really see them and look at the blank camera at the same time. So a good idea is to try to put, if possible, their screen close to your webcam. Remember, they're not in the room with you, so they can't see what you're doing unless it's absolutely completely visible from the screen. So let them know what you're doing. Explain and narrate your actions. So, for example, if you turn to the side, if there's a noise and you turn, let them know. One of the most important things, especially if you're using a dual screen, it looks like you're playing tennis side to side, tell the patient, well, if I'm glancing off screen, it's because I'm looking at your chart, or I want to make sure I record your information accurately, so I'll be typing occasionally as we talk. You also want to make sure you're speaking slowly and pause. The pause is important to prevent that, was it how you first, when everyone's talking at the same time. There's an old saying that a camera adds 10 pounds to your frame. Well, the camera just amplifies everything, makes everything bigger, and it also makes your actions bigger. So if you're fidgety or playing with your hair, touching your face, it's really noticeable. So just be aware of those actions. So let's explore how we would apply the 4 habits in telemedicine. So number 1, invest in the beginning. Remember, the goal of this habit is to set the stage for a welcoming atmosphere that will allow you to quickly determine the reason for the visit and negotiate the agenda for the visit. Now, just like in a face-to-face visit, before you go in, make sure you center yourself. So if you have a ritual before going in a room, touching a doorknob, taking a breath, establish one for your telemedicine as well. And then you want to look at the same 3 skills of this habit. Create rapport quickly, elicit the patient's concerns, and plan the visit with the patient. Now, you'll notice there's going to be some new things you'll have to do as far as introducing yourself and your role. Depending on the workflow in your clinic, you may or may not have a nurse who introduces you because they make the first call. You may actually be the one who initiates the call. We're going to do that as our demo here in this particular tutorial. So you'll need to introduce yourself. I'll give you some sample script right after this slide. Make sure you obtain permission just like you would ordinarily do as a student learner, and make sure you address that elephant in the room, the technology, and assure them that they're in a private space. The other 2 skills are the same. You may want to consider just stopping a moment, taking a screenshot of this particular script. You'll notice in the script, the student identifies the patient, themselves, their role. I like this particular script because it asks not only permission, but also sets this patient to understand how the preceptor is going to follow in later at the end. And also assures the patient some of the value and the benefit of spending time with a student learner. Just as in a face-to-face visit, you'll want to confirm the patient's identity, how they'd like to be addressed, but it's more important than ever at this point not only to let the patient know that you are in a secure location, that their privacy is secure, but also to check in with them. Are they in a place where they can speak and talk safely? It'll also be important to make sure that they are hearing you, that they see you, help them troubleshoot problems. We mentioned earlier about making sure the camera's on a landscape, on the sideways, or also to set up for them how to rejoin the visit if they get kicked out. And as always, Make sure you have pre-screened the chart ahead of time. That will help them know that you know who they are before you enter the room. Habit number 2 is in which we elicit the patient's perspective so that we can uncover important diagnostic clues to the patient's concern, as well as revealing any hidden concerns that they have. This is really similar in the face-to-face and the telemedicine type of encounters, asking for the patient's ideas, eliciting specific requests, and exploring the impact on their life. Be curious. This is where you can really uncover a lot of information. You might find, though, in the virtual world, you may need to paraphrase or summarize a little bit more, because without all of the full nonverbal cues, you might not catch what they're really trying to say to you without those paraphrases. Nonverbal cues are harder to pick up on in virtual visits. This makes habit number 3, demonstrating empathy, a little bit more challenging. You can still be very open to their emotions, whether by phone, by video. This can be quite apparent. But you also need to be aware of your own reactions. Sometimes when we don't have that reflection, we might not see necessarily how we're reacting or not know how the patients are reacting to our reactions. Empathetic statements, you might find that you need to use more of them to make sure that the patient really knows you're listening and is really following what they're saying. And use the pause. Use the pause when needed so that they can have the space to be able to express themselves. Your voice is going to be very important. Watch the tone of your voice, and as silly as it sounds, smile. It really does come out in your voice when you're smiling. And finally, habit number 4, invest in the end, also requires a few modifications in the telemedicine realm. As always, deliver the diagnostic information in terms of the patient's original concern. This helps with the health outcomes, adherence. It helps to reduce return calls. The patient really knows that you heard what they wanted to come to you to speak about and that you addressed it. Now, giving the full education, in the face-to-face visit, we can hand an after-visit summary. We can write things down on paper. Use the technology that's in front of you. The HCA does have a chat window. It does have the ability to share screen results, so it's often nice to show a graph or labs as well. And send that after-visit summary through kp.org. As always, just similar to a face-to-face visit, involve the patient in making decisions and complete the visit. Now, in doctoring this week, you will go through a video visit as well as a phone visit. However, in the LIC, you may find that a particular visit that's booked in one modality should be seen actually in the other. So these are just a couple sample scripts that you can use when you want to convert a phone to a video visit and vice versa. The actual mechanics of doing this switch over is covered in that EIE video of how to do HCA visits. So how do I do a physical exam when the patient's not physically in front of me? Well, the virtual physical exam is a physical exam. You still have the powers of observation. You can look through the video visit to see how sick is this person, how acute is it, what's the environment around them, which gives you additional information about social history and social determinants of health you would not get when they're here face to face. What's your patient's cognition? Are they a valid historian? Does what they're saying match what you see around them? You want to partner with your patient. They can take the vitals, their height, their weight, their blood pressure, their temperature, and assist a member. You can have a member touch this, tap that. Use your technology too. Ask them to upload photos of what you're seeing and include that into your physical exam. And this particular slide just shows how many of the different observable physical exam items that can be completed within a video visit. We're going to finish today's video talking about the depression and alcohol use disorder screening questionnaires. Now, earlier in GEM, we learned about the depression screening questionnaires, the PHQ-9, and the first two questions of that screener about depressed mood and anhedonia, the PHQ-2. In this week's session with the SPs, you will have the opportunity to practice using the PHQ-9. We will provide the copy of the PHQ-9 in the Elentra for you to download and use. You are not expected to memorize this by any matter, as it is a form that's usually filled out by the patient in a face-to-face visit. As Dr. Lowe presented in her prior video, it's really important to create a transition for the patient. Normalize it, let them know that these are questions that are important for their care that you ask to your patients, and ask permission to go further and ask the rest of the questions when that PHQ-2, when those first two questions do seem problematic. You'll also have the opportunity to practice using the alcohol use disorder screening questions. We start, of course, with assessing how many times in the past year they have had an episode of heavy drinking. And then we want to follow up with the questions for the DSM-5 criteria for alcohol use disorder. Again, do not worry about memorizing all of these questions. There is a handout of these questions on Elentra for you to download to have prepared and ready for your time with the SP. I hope this was helpful, and we all look forward to seeing you in person again in a couple weeks and online at this next week's doctoring. Bye-bye now.